a 35-year-old patient that came into me, and this is going to illustrate, you guys have all these elaborate, complicated ways that you're treating these things. I didn't do an awful lot to her, but I do think it created a nice rejuvenated appearance. So I guess kind of starting from the end, talk about what you would do, thoughts on the results. I mean, what would you do?
Well, from what I see here on this patient here, she has some sun damage, photo damage, looks like a little bit of melasma on the side of her cheek there. That's something I would address first and foremost as far as the quality and texture of her skin. Once again, I would approach that with different light-based energies. If somebody has melasma, I would not go to BBL, broadband light or IPL, because that tends to make melasma worse, actually. I would do different combination light therapy. It looks like there was some submental fat loss there, so Kybella or PCDC for contouring. Her jawline is definitely much more enhanced and defined. That to me, when I tend to do that, I will go ahead and do either Bellafill or Radius along the jawline. Now, some people will also use Sculptra, which is equally as good. I also see that you gave her definition and contour in the cheekbones and in the aperture as far as the apex. Her nose tip looks more lifted, if you take a look at it, as well as the distance between the top of the lip and the tip of the nose, and her philtrum looks much more defined.
Top down, I agree. The nose looks lifted. I think her whole profile is just dramatically improved. Her lip, if you look at the true vertical line, everything aligns. Her chin aligns with the lip and her nose, and it's just perfect. I think in terms of volume enhancement, there's probably very little that was done. Minuscule amounts, but there's probably some volume enhancement because her tear trough is alleviated. The jawline looks amazing. I think a couple of ways you can achieve that with this case is either threads, barb threads, or even like a HIFU or like a Ulthera type lifting energy-based device, and or possibly adding the fillers to the jawline. But I think it can be achieved with mesotherapy, Kybella, and an energy-based device, and of course some skin improvement in terms of any laser therapy.
Beautiful.
Alan?
Beautiful hair, eyebrows, and eyelashes. So you can choose whether you'd want to enhance or just protect those areas with non-invasive therapies.
I think you did an amazing job. She looks like 10 years younger to me. How old is she?
35.
Like 30. So I was going to say, somebody like her, like I saw her, like she actually will respond to everything that you had said. Me being the Sculptra guy, I will do Sculptra, and I think I'll be able to get similar results. Not as sharp probably of the jawbone and the chin. Probably after I do a round Sculptra, I may switch to Radius or a Hydro G Prime product to get that beautiful contour that you achieved on the jawline and the chin. I love what you did with the brow. I don't know if that was done with neurotoxin, but overall she looks like a younger version of herself, even though she is actually young, right? So this is more like an enhancement prevention type of result.
So I agree, amazing result. I think in the left side in the before picture, even though she's young, I think she looks a little frumpy. I think what you've done is kind of align everything. If you look at the before, there looks like there's a piece missing from the front of her chin, a piece missing in the pre-jowl sulcus, and a piece missing at the angle of the mandible. So you've kind of added to that, and now the eye catches that straight line, and the face looks less round and heavy. I think you've done something with neuromodulators to kind of reposition the brows. The skin looks better. I'm still trying to figure out if you really did anything to the neck, or that's just the result of doing the jawline.
So what we did, we basically started with the fabric. Okay, put her on a medical skincare regimen, a series of chemical peels. We use a lot of microneedling PRP in our practice as well too, a lot of biologics. That's why you're seeing the improvement in the skin. For the upper third, what you're seeing is the effects of the neuromodulator, as you pointed out with the brow. Try to shape that. Mid face. I try to recreate a V-shaped look, and so I use a lot of fillers for the chin point, lips, also cheeks, so you can create that V up on a woman. I think it's beautiful. So what I did is Voluma in the cheeks, Volbella in the lips, and I actually didn't do anything in the chin here. For the neck and jawline, I use the effects of Kybella, which Kybella not only dissolves fat, but it also creates inflammation. You know, and so as we know from inflammation, what happens with that, we get skin tightening. So, you know, what I was trying to do essentially is not only get rid of a little bit of fat, so fat dissolution, but also too, I come up along the jawline, I inject the jowls, and I try to create basically a little bit of a lip. So that's what I did for her. Very happy patient, and again, I think, you know, I think it really kind of illustrates how you don't have to get very complicated, and you certainly don't have to, you know, as you know, we've got surgeons sitting down here. You don't always have to go the surgical route, and you get a result for a patient that they're very pleased with, and that's durable as well.
How many sessions of Kybella did you do to get this result?
I did two vials apiece.
Okay.
And when you do the Kybella, are you using it as a mesotherapy technique into the face as far as for skin tightening? You're diluting it down or using it full concentration?
No, I'm just using it
full concentration, but just lower dosing as far as the injection sites?
Right. Yeah. Usually I'm using about a 0.1. I mean, a lot of times if you're using it for fat dissolution, you're using about a 0.2. So I go a little bit less, and I really spread it diffusely, so I'm creating more of I'm kind of really shrink wrapping everything. So I'm trying to address the submental fat, but also trying to address the skin laxity around that and create a more sculpted jawline.
And would you continue to do that as a meso technique for maintenance, or would you at that point interject microtoxin for the face and the nipper? A little bit of both.
The nice thing about combination therapies is there's so many ways to get from point A to point B. Right. I mean, you know, anybody that gets up and says there's only one way to get there, they're very myopic. Okay, because nowadays you can use, you know, energy-based devices, biostimulators, fillers, neuromodulators, skincare, what have you. You know, and create. I mean, you know, you're hearing from the panel here that there's a lot of different variety of ways of doing it. So, you know, first key thing is understand what's in your toolbox, what works best in your hands, and then you can create these, you know, these great results that are obviously all these results are non-surgical.
And that's something that I actually want to emphasize that Dr. Buford just brought up, is that you have to see what's in your toolbox. Everybody has different clinical expertise and skills, and this is the reason too, through Empire Medical Training, when people come and take these training courses and programs, people get the wisdom, the pearls, the different experience from every single instructor who has different experience and expertise. And I think that's something that we all learn from each other. That's the reason we go to conferences, go to CMEs, we all have these panel discussions, we all compare notes with each other because we can all learn from each other. And I think that's something that is very valuable for any practitioner, especially in the world of aesthetics, from a safety standpoint, from a cosmetic end result standpoint, as well as just for people to be able to enhance and give natural results, as opposed to just doing things because not one size fits all, as we know in the world of aesthetics.
Yeah, I mean, I would add to that you know, learning from your peers is invaluable. You know, and if you think you're so talented, you don't have to learn anything anymore. It's about that time to hang up the shingle.
Absolutely, absolutely. That's so true.